a reconfigurable, additively manufactured Vibrotactile stimulation device for chronic pain.
Did you know that approximately 50 million patients living in the United States have chronic pain? And by chronic pain, we mean persistent pain that lasts over extended periods of time. And unfortunately, the treatments for chronic pain are relatively limited. It can include things like pharmaceutical treatment, corticosteroid injections, or surgical operations.
Having a device that can bridge this gap between superficial treatment using medication and extremely invasive and often non-reversible treatment that is done surgically has a great need.
Introducing our BCI-driven Vibrotactile nerve stimulation therapy for chronic pain treatment.
Our first attempt was to find out what pain looks like in the brain and try to train patients suffering from chronic pain using a brain-computer interface to produce these brain patterns. The key player for the system was the Vibrotactile device. Why? Because by stimulating a painful area with vibration, we're able to create short-term pain relief. The idea here is that the non-painful stimulation will actually block out the pain signals being sent to the brain. By pairing this physiology with the brain activity associated with pain relief, we're able to produce some really promising results without any kind of pharmaceutical intervention.
That original device was used in a 6-subject trial targeting hand and wrist pain. This provided preliminary evidence that a brain-computer interface in conjunction with vibrotactile stimulation at the point of pain could reduce chronic pain symptoms. We also learned that continued testing and ultimately the commercializability of the device would require a more targeted and easily operated form factor. With that directive, we began designing and prototyping a series of modular and reconfigurable device iterations. They included vibration delivery components, structural components, and vibration isolating components. Through this process, we made extensive use of SolidWorks for CAD design and a Formlabs Form 3B resin printer and its clean and cure machines. Initially, we produced all of the components in a Formlabs 80A resin, which is about the hardness of a bicycle tire. However, we migrated our structural components to rigid ratcheted frames in order to provide a stable platform that could still be administered without lateral skin friction. We also discovered through laser Doppler vibrometer testing that the flexible frames didn't really contribute a measurable difference to vibration dampening. However, the flexible lattices that we printed in the ADA resin, especially when combined with a metal mass, were able to reduce vibration transmission from contact point to contact point by up to 90%. Through this process, a total of 10 frames made from a combination of 4 different materials were fabricated and tested, and dozens of modular vibration nodes and vibration buffers were fabricated in the ADA resin. A late-stage device was then used in a new preliminary trial.
In order to validate this device, we wanted to see how different features of vibration affected brain activity. We can actually study what's happening in deeper brain regions with really high resolution by working with patients being monitored for epilepsy. These patients have stereotactic electrodes implanted in their brains, which we can use to provide valuable insights into how the brain works. We stimulated the hands of these patients with vibrations of different features, and what we found is that we can produce different physiological effects in the brain depending on the location and the frequency of the stimulation. We plan to use these findings to better understand how vibrations can interact with pain processing networks, as well as eventually optimize a pain relief brain-computer interface. And what really set this new device apart was how easily and quickly we could set it up and how much more comfortable it was for the patient over longer experiments.
This device was designed to be reconfigurable. Reconfigurable in multiple dimensions, meaning it can be reconfigured to situate on the hand, on the foot, or another extremity on the body. It's reconfigurable also in the sense that we can move the actuation nodes around, which means we can do targeted patient-specific treatment. We can imagine a couple of use cases for commercialization. One is in-clinic therapeutic treatment. The second is more of an at-home, take-home therapeutic treatment.